Last time on Spilling Positivity.
Completed menopause over 5 or 10 years ago because you are now introducing back something that your body wasn't accustomed to.
Right.
But if you actually narrow,
This week, time for part 2.
you can see the benefits and you don't have those effects.
Absolutely.
So let's talk now about cervical cancer, and all that surrounding, especially from the perspective of what is cervical cancer.
So the female reproductive organ is made up of different structures. You have the ovaries, which
We have a wonderful apparatus
Yes.
there.
Yes.
Okay.
Let's show you have a
I'm not
crop.
sure if the camera can see it, but we'll try to explain. So this is looking at the female reproductive system from the inside. We don't have the lips on the outside, which is the vulva and the vagina. We have the birth canal or the vagina. We have the cervix, which is your neck of your womb.
Yeah.
This is what produces lubrication. This is what controls the menstrual effluent from the womb into the birth canal.
okay.
This is what, when women go into labor and they ask how far dilated, this is what opens up 10 centimeters
Wow.
to allow baby to come from the womb into the birth canal.
Okay.
That.
This, 10 centimeters. Baby head has to pass through here.
We are a magical
are
Yep.
incredible.
If you
Yes.
think about it, a baby developing from just an egg and a sperm in utero and growing into a complex
Yeah.
baby,
Yeah.
and then being
And coming-
delivered.
yeah.
So
Wow.
this is where we actually do, there's a brush that we have here,
Yeah,
but this
take
is
it.
actually where we take the cells from when we do a pap smear. So this comes in and we swirl it around here, and this is a soft brush. And what that does, it just grasps some cells, and we put that in a culture medium or a storage medium.
Yeah, we have that to
Bottle
show
there,
as well.
And this is sent off to the lab. So we just dip it in there. The actual tip comes off, so we don't even have to dip it. We just drop it in,
Okay.
right? And that sends off to the lab, and we can pick up cells.
Okay.
So I was going through the female reproductive organ in terms of the vagina and the birth canal, the cervix or the neck of the womb or the uterus. This is what cries every month when you don't get pregnant with your menstrual effluent, and this is what holds baby in for 9 months.
That.
Okay.
Yeah. So the storage organ and then a propulsive organ when we go into labor. The tubes, these are what transport eggs from the ovary. The ovaries are the equivalent of the male gonads. The female gonad is the ovary. These what produce hormones on a monthly basis that make women the lovely creatures they are.
Yeah, okay.
And then produce eggs on a monthly basis during their reproductive career. So for women who have not had a pap smear, it may be a daunting experience to go,
Yes.
first of all, undress below the belt, sit down on the bed,
Yeah.
expose your private parts.
But you're not really exposed.
But you're not.
You're not.
So you may say so, but
Yeah.
you're accustomed coming to a place where you're given a gown, you have a sheet over your lap, you're put in a position. It's an experience where you have a conversation.
And then you're talking, you're
Yes.
talking
We
the
try to
most.
distract you,
Yes.
and we guide you through the process and relax you. But that's not the case everywhere else,
Yeah.
right?
Not everybody's actually been to, but Maria and I both, our parents have made sure that
We started.
had good health,
preventative
practices.
medicine?
Exactly. From the time we were, what, 16?
16, 17.
And there are people who have never, when I hear people who have never been to a gynecologist until maybe they were pregnant, or if they haven't had kids, there's some people who've never been.
Yeah.
I'm always
So
amazed by that.
People think that a pap smear is done to detect cancer of the cervix, and it's not true.
It isn't.
No. Pap smears are actually done to prevent cervical cancer.
Really.
So what you're doing, you're actually looking at the cells, trying to pick up abnormal cells before they become cancerous.
Before they
So
become
you can
cancerous.
treat them and nip them in the bud. Cervical cancer is 100% preventative.
And it's just from getting your pap smear.
So from the 1970s, from the introduction, you see, y'all are beautiful women, because what y'all have done since the 1970s, you've accepted this test as part of your DNA.
Yes.
You
Right.
go yearly, you go get your pap
Absolutely.
smears, you pick up abnormalities. We can treat those abnormalities and we can prevent cervical cancer. And we've seen a significant reduction in cervical cancer incidence since the introduction of the pap smear in the 70s.
Right.
So you've had 50 years plus of pap smears. But what we've been seeing now is a plateau in cervical cancer incidence.
Okay.
It's not going down any further. And that's where now research has gone in and found that the cause of abnormal pap smears and the cause of cervical cancer is actually due to a virus.
Oh, HPV?
The
Yes.
human papilloma virus,
Okay.
correct.
Wow.
Okay.
And now in our armamentarium against the fight against cervical cancer, we have the HPV vaccine. So what this is doing is basically bolstering your immune system that if you do come into contact with the virus, you can fight it and eradicate it. Now people get scared when they hear virus, right? Why? because of the good work we did in the 1980s, scaring people about virus. What we did in the medical community, we scared them about HIV.
Yes.
And HPV only has one letter difference. So they think HPV is similar to HIV.
HIV.
Yeah.
That's not the case.
Wow. Okay.
And you have to appreciate that your body has an immune system. So the same way you can get a respiratory virus or a cold virus, it doesn't mean that you're going to get pneumonia and die when
Right.
you get a cold. Your body
Yeah.
has an immune
Yes.
system and fights it off. It's only high-risk viruses that can persist longer and challenge your immune system. And we saw that recently with COVID.
Right.
Yeah.
COVID is a respiratory virus. Majority of people recovered from it. Yes, they felt bad, but it's still a small subset who are immunosuppressed or immunocompromised, either based on age or comorbidities, ended up requiring more assistance, either requiring oxygen, ventilatory support. So even though there are over 140 HPV viruses, only 40 affect below the belt.
Okay.
And out of those 40, only 14 are high risk. So what happens is that these vaccines are targeted against the high risk HPV. HPV is very common, you know. You know how it's spread? From skin to skin
From skin to
contact.
skin.
So she either just gave me HPV or I gave her
right.
HPV. Little children have warts on their
Yes.
finger,
Yes,
which is
that's
caused by
HPV.
HPV. So once you start having skin to skin contact down there, you will in your lifetime get an HPV infection. That is without a doubt.
Right.
And what's going to happen is that your immune system is going to fight it and get rid of it. What pap smears are doing are picking up abnormalities caused by HPV that we can then investigate further and treat and get rid of.
So the vaccine is for young women, very teenage.
So when we started off, obviously cervical cancer is something that only affects women. And what they looked at was introducing it in women between the age of 9 and 13.
Yeah.
So try to get everybody, if you don't have the resources to immunize the entire population, you start at someone who, before they start having skin-to-skin contact down there, before they start having intercourse, vaccinating them and boosting their immune system. What has happened since its introduction, we've expanded it to boys,
Oh, okay.
Okay.
and we've expanded it to women and men.
At past a certain age, so you can get it at 25, 30 now?
Yes, you can get it
Okay.
up to 45, you
Up
can
to
get it even
45.
beyond that. So everything that we do has to be evidence-based. So when they started the research with the HPV vaccine, they limited it to 9 to 13.
Yes.
Then they expanded it to 26 in
Okay.
women. Then they expanded it to boys because HPV also causes other cancers. I'm not sure if you're aware, but HPV causes oropharyngeal cancers, causes cancer of the anus, cancer of the penis. So there are other organs that can undergo changes.
Right.
So what they have found out by introducing it to not just girls, but also women, boys, and men, you get something called herd immunity. Herd
Right,
immunity is where you immunize majority of the population, because guess what? How do the girls get it? From skin to skin
Skin,
contact.
Yes.
yeah.
So they had to get it from somebody, whether it be a boy or another female. So by you immunizing them too as well, you kind of reduce the risk of them having the virus on them to pass it on.
Yeah.
And since the vaccine introduction, we've actually seen now a further reduction in abnormal pap smears, and now we're seeing a reduction in cancer incidence too as well.
But cervical cancer is not just caused by HPV.
Majority of the time, yes.
Really?
Over 99% of cases
Okay.
are caused by HPV.
Okay.
So if you can prevent HPV transmission, you
Right.
can basically go upstream and then reduce the abnormal pap smears and eliminate 100% cervical
Okay.
cancer.
So because people, I think
Yeah.
people feel that there's a stigma that, it has to do with sex and, maybe somebody
you're
being-
absolutely correct. I went to a conference in Chicago in 2009, and this lady was there speaking about her cervical cancer experience. She's a celebrity. Her name was Fran Drescher.
Yeah,
Fran
used to be-
Drescher.
She used to be
the
the
nanny.
Nanny. Yeah,
Correct.
yeah.
Those who used to watch CBC back in the days, when that was the only channel, that's what we used to watch on the evening, right?
Right.
So Fran was speaking about her cancer experience, and she started a movement, I think, called Cancer Smasher, something
Yes.
like that.
Right.
So you're quite right. There was a stigma associated with cervical cancer before the gentleman who discovered HPV as the causative factor. Just to let you know, Harold Zuhausen, the gentleman, won a Nobel Prize for his discovery that HPV was responsible for cervical cancer.
Okay.
But before we knew that, we kind of tried to get the demographic of the high-risk population of women who got cancer. And we found that women who did not receive regular medical checkups and did not have a pap smear, women who had multiple sexual partners, women who were immunocompromised. And when you think immunocompromised nowadays, you think HIV.
Right.
But immunocompromised doesn't just mean HIV. It could be women who have autoimmune disorders, who are on medication like steroids, women who are diabetic, women who are overweight. That's
Okay.
immunocompromised. Women who did not exercise.
Right.
So we found that, and then we found that women who smoked. And when you put that all together, there was a stigma because you thought this was somebody who was potentially promiscuous. They were having, because you only need to have one partner give you HPV. You don't need to have multiple
Yeah,
partners.
Right.
Right?
That's
so you
right.
can have one partner your whole life and still get HPV. So yes, there was a stigma. So in 2009, when I went to that conference in Chicago, she opened up about her cancer experience. It's the same thing. When you find a lump in your breast, you tell your colleague at work, I'm going to get this test done because I found
Right.
a lump. If you got an abnormal pap smear, your private parts are private. You don't
Right.
tell
Don't
anybody.
tell
That's
anybody.
So the awareness is not there, and that's why we're having these initiatives to try to make people aware that this is something that's completely preventable. Even when we introduced the vaccine, you know,
I
people
remember
were,
that.
people were concerned.
People were very
Yeah, there are
upset and
lots of
weren't- did
Is this
not
a
want
license
to
for their daughters to
have
have
sex?
sex?
Yeah.
And that's not true. I mean, it's just, and I think we've become a little bit more tolerant to vaccines, especially in the last 3 years.
Yes.
And we've seen the uptake in the HPV vaccine, but we're hoping that cervical cancer could be something of the past.
Right.
Yeah.
Right.
So what are some of the treatments for, so you go, you get your diagnosis, you have abnormal pap smear. Does
smear.
it automatically mean that you have cervical cancer?
No. So remember, we're trying not to pick up cervical cancer. We're
Yeah,
trying
yeah.
to pick up
Abnormalities.
abnormalities that can lead to cervical cancer years down.
Okay.
If you have an abnormal pap smear, it means that you need to have a further test done.
Okay.
Okay.
And that is usually referred to as a colposcopy. Big word. I'm going to break it down. Colpo means cervix in Latin. Oscopy means to look at in the microscope.
Okay.
So what happens when you do a pap smear and you send those cells to the lab, those cells are being examined in the lab under a microscope.
Right.
What you're doing now, you're bringing the microscope to the patient.
Okay.
Okay.
The microscope magnifies the cervix, allows us to put different solutions on them to better identify the degree of abnormality. Because the degree of abnormality would then determine the degree of treatment that you need. So sometimes when you actually do a colposcopy, somebody who's had an abnormal pap smear, you see everything looks normal. And what has happened in that scenario is that your body has healed itself. Because remember, like any other virus, if you get a cold, you don't necessarily need antibiotics. Your body has an immune system
Right.
that can fight it off.
Yeah.
So you healed yourself. Sometimes we pick up a mild abnormality. Once we confirm that, we can just freeze those cells
Yeah.
and get you back to normal.
Right.
Yes, yeah.
If the abnormality has progressed further, what we call from a low-grade abnormality to a high-grade abnormality, then we may offer excision treatments.
Okay.
Okay? And these are laser or loop that we use to just remove the cells. And the reason why we want to remove them is that we want to confirm that everything has been removed and everything is back to normal. So that means you go from either being normal to having low-grade abnormality to high-grade abnormality. Before you get to cancer, you can then intervene midway and get you back to normal.
Okay.
So while we wrap up now, what are 3 things you think every woman needs to know as part of their preventative care for their below-the-belt health?
So your below-the-belt health is also dependent on your general health.
Okay.
And what I tell women how best to prevent cancer of your gynecological parts is to live a healthy lifestyle.
Right.
When I say live a healthy lifestyle, it doesn't mean eat only vegetables and fruits. It means eat things in moderation, have exercise as part of your daily life. I think you should pay attention to your body. That's the second thing I would say.
Right.
Because things change. Now, things changing may be an indication that something is going wrong.
Yeah.
If you start to feel bloated or you start having bleeding in between your periods,
Or
that's not-
strange odor.
or a strange discharge and odor,
Right.
that's something happening. And what you need to do then is seek medical attention.
Yeah.
Obviously, I'm not going to tell you if you go and eat bad food and then you get an upset stomach
Yeah.
and you're bloated, that you need to rush to a doctor.
Yeah.
But if these symptoms persist for more than 2 weeks,
Yeah.
then seek medical advice.
Yeah.
Don't just think it's I'm having burning when I'm urinating, go to the pharmacy. It's
And
a
get-
UTI.
okay.
Because that may work, but then if it comes back again, it should raise a flag.
Right,
So
right.
something may be off. So you asked me what 3 things. So live a healthy lifestyle, pay attention to your body, but don't wait on symptoms to occur before you seek medical attention. I think
Yes.
prevention is better than cure.
A
Absolutely.
yearly
A
visit.
yearly visit. I agree. You know, go to your doctor, get your check, make sure everything is good down there so that you can help prevent cancer.
And your mental health plays a role as well?
Of course. Remember, health is not just physical, but mental as well as social well-being.
Yes.
Yeah.
We don't appreciate, but the woman is the core nucleus of a family.
Yeah.
And if a
right.
woman gets sick, it's going to affect everybody
whole
around her,
yeah.
the family, the community. So that's why it's very important for our women. I mean, they're not only pillars of society, but they are leaders now.
Yes.
Our president, our prime minister,
right.
our ministers, our teachers, our doctors, our
Yes.
lawyers.
Yeah.
Everybody can be affected by women's ill health. And I think
Yeah.
that's why it's very important that we look after them. here in
Definitely
Barbados.
so.
It has been awesome, as usual.
He has to
Whenever-
come back.
You have to come back. Are you going to come
Anytime,
back?
anytime you want me, that's no problem.
We are so happy to have had you here. Thank you so much for joining
Thank you
us.
to Lipton. I mean, I enjoyed
Yes.
this
Yes,
beverage here.
yes, thank
Listen,
you.
we are
Giving this
so
interview.
happy and thankful for our sponsor, Lipton. And, you know, we just want to say that make sure, Maria, what are some of the things we want our viewers to remember?
Remember to go get your annual health check, mental
That's
health
right.
check. Sorry, physical health check below the belt. That's
Yes.
really important. Good diet and exercise.
That's right.
And just good
Pay
mental
attention
health.
to your
mental
body,
health.
yeah.
Pay
Yeah,
attention. Pay attention to your body.
So that's it for this episode. We are so happy. Thank you for
Thank you for
joining
having
us.
me.
And we will see you next time on Spilling Positivity.
Stay positive. Thanks.